So there's a categorical track, which is 2 years of pediatrics and 3 years of child neurology. Okay. There are certain programs which have research dedicated tracks where they will do 1 year of pediatrics.
Hello, hello, hello. Hey, that's not the right angle. Don't look. Don't look. Hello. Don't look. Behind the scenes. Let's get the right angle here. 3, 2, 1. There we go. You get me today. I haven't shaved today. You get me. What's up? I hope everyone is doing well. Hope you are having a fantastic day. We have a great guest. We have Dr. Sonika Agarwal here today. Let me bring her on as a panelist. Dr. Agarwal, come hang out. As we're waiting for Dr. Agarwal to join, let me know where you're watching from. Let me know if you potentially are interested in some neonatal neurology. Hello, Dr. Agarwal.
Hello.
How are you?
Good. How are you? Thank you for having me.
I'm wonderful. Thank you for taking some time to hang out with us. Sure. Let me open up the chat so I can see where everyone is from. DC and Baltimore, Austin, Bay Area. Dr. Agarwal, you have a very interesting journey behind you from where you came from, where you are now, the merging, it looks like, of 2 different specialties into one. Let's talk about the specialty that you have now. Mm-hmm. How did you come about creating that specialty for yourself?
So, as you introduced, my path has been a little convoluted, not like a straight path, but I started out as a maternal fetal medicine specialist, and so maternal care, long background in that. And while I was exploring, after my move to the US, when I was exploring what specialties to choose, the options were unlimited, and I applied to several, and I could say that child neurology chose me. It was one of my choices, but the way the match worked out, I ended up matching to the fellowship before I matched to the residency, and I said, let's do it, and let's merge the 2 careers and make a career out of fetal and neonatal neurology.
Very cool. And so just for clarification for someone listening, as a maternal fetal medicine specialist, MFM, you were an OBGYN.
That's right. And MFMs mainly handle difficult and high-risk pregnancies.
Yep.
So challenging prior losses, lots of complications in pregnancy, medical disorders, obstetrical complications, all impacting the baby. And in my role now, impacting the developing brain, the fetal brain, which is the field of fetal neurology, how child neurologists are now getting involved in pregnancy earlier than before.
Yeah. Awesome. And I know you're going to talk about kind of this newer field of fetal neonatal neurology. Do you have a presentation for us, or do you want to just talk?
I do have a short presentation that I can wrap up in like 15 minutes or 20 minutes, whatever you want me to do.
Yeah.
And then we can go over questions.
Let's do it.
Let's do that. So can you see like in the PowerPoint?
Yep.
Is it in the presenter mode?
It is not. I see just the regular PowerPoint.
Where do this looks like a little slide control now. Let's see. I do not see the place here to, I know I've done several presentations on Zoom, slide control apps.
I think we're okay with the view that we have. If you just want to, I think right above the scroll on the side, the little, I don't know, scrolly thing, what do you call that? I can't think. There's a little caret. If you hit that up, it'll make the ribbon smaller on the right, very right side where you're at right now.
So show subtitles settings. So I see mute, stop video, participants, chat, Q&A, new share, pause share.
Let's see.
Annotate, slide control, apps, more. That's all I see. One sec. Show.
If you just go to slideshow and view slideshow, are you in presenter mode? Like you have the other?
Let me stop share and share again.
Yeah.
So my PowerPoint is open. Share, this may work better.
There we go.
Okay. Is that better?
Yep.
Okay. Now, okay. So thank you for your patience. Hello, everyone. This is an overview of the field of fetal and neonatal neurology, which is a subspecialty in child neurology. And it's a very new and evolving field. And so I'll go over a little bit of my career path. Now, one of my students is texting me, is this that they are unable to join from the link? Is this like a live recording?
Yeah, we're live. There's 124 people here, so.
Okay, so she really wanted to join. So can I share that link that you have sent with her?
Yeah, anyone can use that link.
Okay. Okay, so I send it to her. That way she can also listen. Okay, so my career path has been a little convoluted, so I'll try to give you a little overview of my background and then go over what I'm currently doing. So, and how we merge maternal care, which is obstetrics, and child neurology, and we make a field out of it. It's called fetal and neonatal neurology, or it's perinatal neurology. And this is a very interdisciplinary field, both in education, in clinical care. And it's the perfect example how clinical collaborations and networking with other specialties can really improve the outcomes. So I started my career out in India long back, went to med school, trained in OBGYN, and was practicing as a maternal fetal medicine specialist for a long time. And then I moved with my, based on my family's move to the US through my husband's work. And as I was exploring specialties to train in, because I had to do the residency again, I ended up choosing child neurology. I did try for other specialties, but the move a little late in my career and surgical specialties being over competitive, I ended up choosing child neurology. And fetal and neonatal neurology is basically a merger of early care of the fetal brain and what we can do as child neurologists early, starting from the period of conception. And it actually brings in the view of maternal health, how good maternal care in pregnancy and preconceptional health can have an impact on the developing brain. And then this is an example of a fetal MRI, and this concept of first 1,000 days starting from conception until 2 years of life, when critical and sensitive development of the brain leads to lifelong establishment of the networks that impact brain health across the life course. So if you, why is this field important and why I'm so passionate about it? If you look at the global burden of disease, the green on this curve, in the pediatric population, 1 in 5 children live with a neurodevelopmental disorder. But if you were to look in 0 to 28 days of life, look at this green bar here, it's as high as 40%. So the disability adjusted life years alone due to neurological complications in a neonate, which includes 0 to 28 days of life, a little baby, soon after they are born, is as high as 40%. And looking at what is neonatal neurology and how fetal neurology is now evolving from neonatal neurology is, so neonatal neurology bridges the care of the pregnant mom, how a mom has any maternal complications, any other autoimmune disorders, medical disorders, obstetric complications, early life exposures, exposures to drugs or medications or alcohol, and how this impacts the placental health, how the placenta matures through the pregnancy. There could be multiple placental conditions, and the field of placentology is also evolving now. And then comes the role of the child neurologists after the fetal neurologists, who are mainly focused on the care in the early pregnancy and later months of pregnancy. These two fields go together. So we have to have a good background knowledge of a mom and the baby, how they did in pregnancy, as we explore the conditions that present in the neonatal period. So babies could present with encephalopathy, which is they are not looking right, they're too sleepy, their reflexes are depressed, they are needing resuscitation or respiratory support. They can present with seizures, they can present with stroke. Prematurity is a big burden to the neurological diseases of the newborn. And then abstinence syndromes and other associated medical or neurogenetic conditions. Now, our job as a fetal and neonatal neurologist is to connect the pregnancy problems, the placental problems, and the fetal problems, and see how the baby is presenting. And this is a very dynamic field in the way that as pregnancy advances, the care, the level of care, the referral process, everything evolves as new problems present in pregnancy. And as this diagram shows, it's not just the fetal brain and the structure, it's also the early life exposures and exposures after that that lead to the formation and the impact on the molecular and pathological networking and cause structural problems or lead to genetic problems. And then the phenotype or how a baby presents across lifespan, it actually changes based on these multiple factors. So this diagram pretty much in one slide, if you have to describe fetal and neonatal neurology, what we know and when we know and what we are doing about it is changing. So earlier a baby would be born and they would present with developmental issues to a neurologist, child neurologist at maybe 6 to 12 months of age. But now in pregnancy, once they have an abnormal ultrasound, they get referred for a fetal MRI, which is the field of fetal neurologists. And then child neurologists like me will get consulted to go over the counseling process with the family as to what to expect. We discuss the images, we discuss any genetic testing. And genetic testing in pregnancy is also getting really advanced. And then as the pregnancy progresses, how the mom's medical and obstetrical complications change with the future months of pregnancy, that impacts the place of delivery, the mode of delivery, and which center or referral institute they may end up in. And This is a very multidisciplinary field, along with MFMs, geneticists, other specialties. So if a baby has a renal issue or a cardiac issues, those specialists will get involved. Pediatric neurologists or fetal neonatal neurologists will get involved. And then other specialties, medical specialties, including ethical and palliative, are sometimes also involved when a baby is really not doing well. And then comes the long-term care of the newborn. And just going over some case examples. So the kind of patients we see as fetal and neonatal neurologists. This is a baby who presented with expanded fluid spaces. So this is a fetal MRI. This is the head of the baby. This bright butterfly-shaped area is the ventricles or the fluid space in the brain. And this is the MRI of the baby after they are born. And so the fluid spaces were expanded, and the baby ended up requiring a shunt soon after delivery. They had some genetic testing, which was not very diagnostic. And as child neurologists, we got involved in the pregnancy. We counseled the family. We met the baby in the newborn period in the NICU, which is the intensive care nursery. And then we follow them for their development. And this baby is now, this child is now 3.5 years old and is doing pretty remarkably well with their development, even though their brain is quite abnormal looking. So the kids sometimes really surprise us, and networks and cross networks develop the role of early intervention, the role of care, supportive care from a family, a high educational environment. All these have a great impact on the outcome. Now, this is a baby who had, this is again a fetal MRI, if you look on this part, and had some mild expansion of the fluid spaces, some irregularities in the fluid pockets here. And this baby actually had a congenital infection. So when they were born, they had rashes and their liver and spleen were elevated. So they were diagnosed with the urine test for CMV, congenital cytomegalovirus infection. And she's now over 3 years old. She has some balance issues and hearing loss, for which she wears hearing aids. And although she started out with developmental delay, she's now running and walking and speaking in sentences and is a very smart girl. So again, started out with significant challenges around the time of birth, but doing really well. So it's very rewarding at times to follow them over the years and develop a relationship with the family as to how they're doing. Now, there are some kids who don't do as well. And these are, again, examples of fetal MRI, where the brain was partially fused. There was this big cystic space at the back. And these are actually two siblings. So the top one is one child, and this is their younger sibling. They both had pretty similar brain malformations, and they are both profoundly delayed and are benefiting from multidisciplinary and supportive care, but they are unable to speak and have limited intelligence. Then another very interesting type of patients we see is agenesis of corpus callosum. So as some of the students on here today might know, this is a connecting bridge of millions and billions of nerve fibers which connect the right and left side of the brain. And for this baby, the connection was missing. So there's a lot of research going on networks, and I'll explain this picture, but when babies are born with a missing corpus callosum or connecting bridge between the two sides of the brain, they can have a very wide spectrum of outcomes. They can have mild delays, or they could have more profound delays. They could just have a mild learning disability and attention deficit hyperactivity disorder and some social awkwardness, or they could be more profoundly delayed and have seizures, more so when they have a genetic syndrome, or other parts of the brain like the cortex are not well formed. Now, there's some exciting new research going on in this field, and for some of the students who may be interested in research, if you look at this functional MRI, this colorful image on the right corner, Now here there is a bridge, the corpus callosum is there, but in this one, the right and left side of the brains are not connected. And in this network study, the functional MRI, the researchers and what we call diffuse tensor imaging, the researchers found that the intrahemispheric connections, so connections between inside the right brain and inside the left brain, actually changed, and they became very much stronger when that bridge was absent. And this was probably, they're trying to understand how these children who have mild developmental deficits with such a big part of the brain missing, how they are doing so well. So a lot of research is going on into understanding the networks of the brain. Now, for some kids, when we don't get involved in the pregnancy, sometimes babies can present and get admitted to the intensive care. So this is an example of a little baby who had a big bleed in the back of their brain and had a difficult delivery. And this is where the area of the old blood shows. And then a follow-up MRI a few months later showed that part, this is the vermis or cerebellum of the back of the brain that controls the balance. So this kid had balance issues, coordination issues. You can also see speech issues with speech delay with such injuries. And usually they'll get connected with physical therapy, occupational therapy, speech therapy. Some may have feeding issues early on and then they get better. And for this child, although he's walking and he's talking in phrases, he still has some balance issues and a little social development is delayed and emotional issues, which we are closely monitoring. So some of the examples of what we see as fetal and neonatal neurologists, and for any family, while they are looking for a really happy time of having a child, when such events happen, whether the brain is abnormally formed starting in pregnancy, or if a child has some critical illness, they end up in an intensive care nursery, and they're surrounded by lines and tube and procedures and tests after tests. And the families have a lot of questions for us as child neurologists and fetal neonatal neurologists. How's the baby doing? How's the day-to-day going? What more testing is there? What caused this? Can this happen again? What will they look like when they are 6 months old? Or what will they look like when they go to school? Will they be intelligent? Can they play sports? So our job as child neurologists is to give them all this information to the best degree we can, and follow them and empower the families, connect them with all the disciplinary, multidisciplinary care, early intervention programs to help them achieve the best outcome and optimize their neurodevelopmental outcome. So a little bit about how these children may grow up, some who have challenges early on since fetal life or at the time of birth. This is the story. This is a personal story. This is my son in the pictures. So cerebral palsy is a most common motor disability in childhood. And so he had complicated issues around the time of birth, was in the intensive care for almost a month, had hypoglycemia, feeding issues. He had developmental delay and walked late, and he's fully conversational. He attends high school. These are some of his vocational program at school. And again, our job as child neurologists is to follow these kids long-term, empower the parents, make sure they are getting what they need for all their therapy and multidisciplinary care, and get involved with the school program to see how best the individualized education plans can benefit and help and optimize their outcome. So I merged maternal and pediatric care, and then there is this personal why, which made me really passionate in focusing on child neurology, and especially fetal and neonatal neurology, because kids, many times they surprise us. Some do so much better than what we think they will do. And every child is so unique in the way they write their own story. Now, one important thing about this field is the global movement behind the field of maternal care and the early pediatric care. So both WHO and UN, they have the Sustainable Developmental Goals, and there is a global movement for every woman, every child, or every newborn action plan, and sustainable goals have been set for each country so we can work on the best outcomes for babies, and because that impacts children and then child leading to across lifespan. What we do for the moms and for the fetal brain and for neonatal brains has an impact on the brain development across lifespan. And this is the most important and critical vulnerable period where if the care is done appropriately and promptly, it can help a long time. It can have a long-term impact on the outcome of a baby. So that's the end of my presentation. These are the picture of some of my institutes in India on the left, where I was an OB. They're doing a C-section. And then I trained at Texas Children's, where I did the child neurology at Baylor College of Medicine, and got trained into fetal and neonatal neurology. And I'm currently at Children's Hospital of Philadelphia. And this is a family where the twins from whom I followed from the fetal period till as I see them grow over the years. So that's the end of my presentation. And I can probably stop sharing.
Wonderful. Thank you so much for that presentation. I share it every once in a while that I have a daughter, an 8-year-old, who has SMA. And so we're very familiar with the child neurology world and all of the fun therapies and stuff that are out there to help kids with neurologic struggles, so to speak. So it's an awesome specialty. We love our physicians and other providers that are helping. So what is the timeline? So let's ignore the OBGYN start. So neurology plus fellowship training. What is the timeline to become you?
So it is 5 years. There is 2 years of pediatrics. So there's a categorical track, which is 2 years of pediatrics and 3 years of child neurology. Okay. There are certain programs which have research dedicated tracks where they will do 1 year of pediatrics, followed by the early child neurology fellowship, and then research year is divided throughout those 5 years or towards the end of the 5 years. And then there is certain dedicated spots. So some people may decide to do child neurology after doing pediatrics. So there are certain reserved spots for the fellowship for the advanced PGY 3 to 5 years.
Okay, awesome. So it takes a while to
get
through training.
Mostly 5 years.
Yep.
And there is another specialty called neurodevelopmental disabilities. So some programs are structured for an additional year of that neurodevelopmental disabilities.
Yeah. Okay. And what does a day in the life look like for you? Are you mostly outpatient, mostly inpatient? Is there a mix? What does that look like for you?
Yeah, so the mix could depend on what one wants to do. On an average, most child neurologists would do 6 to 8 weeks of inpatient. I personally like teaching and working with residents and trainees and students a lot. So I do more of inpatient time where you have a full team of students and different level of trainees, both pediatric and neurologists. And then you could do the rest of the weeks as outpatient. So there are programs that allow some flexibility in the way you build your schedule. Some want to go into just primarily outpatient. They would opt for that.
Yeah.
And by outpatient, you would typically be in clinic. If you are a clinician, you would be in clinic 4 days a week, all day. And then 1 day would be your admin day to answer your messages and catch up with your work.
Yeah. So here's a question. So it's a very subspecialized field.
Mm-hmm.
Is there enough out there for someone who wants to be out in the community, or do you really have to be tied to an academic medical center to have enough patient population?
So actually, there is a lot out there in the community. So even for a big center as CHOP, we have several satellite locations where there are child neurologists who primarily want to do general child neurology, community, what we call community child neurology. Mm-hmm. And it's all general child neurology, headache, tics, seizures. So all the ADHD, whatever problems you want to see, whatever comes your way. So there is always a mix. There are practices which will be primarily focused on all outpatient general child neurology. It is a very diverse field. With being a general child neurologist, you could be treating any of these babies I talked about. But yes, specialty centers will have those tracks of epileptologist or neuromuscular specialist, like for SMA and other muscular dystrophies, or like headache specialists or fetal neonatal neurologists, neurogeneticists. So there's like as many subspecialties you would want to create, you can have a career out of it.
Yeah. What do you like the most about your specialty?
What I like is for fetal and neonatal especially. So I like the connection with the family and long-term connection. And I think that was the inherent nature as an OB, where you get to connect with the family of the most. So I meet the mom in the pregnancy and when the baby is born, and trying to support them over the years and see them develop over the first few years. So I think that trust and connection with the families is my most rewarding part of being in child neurology.
Yeah. I heard a thing a while ago that's not related to medicine at all, but just human psychology, that humans are either most disappointed or most angry when expectations don't meet reality. A child with a genetic condition, with CP, with SMA in my own world, those expectations, whether it's known during pregnancy or found out post-pregnancy, those expectations aren't meeting the reality of these people having their potential firstborn, going, oh my gosh, we're going to have a baby and we're going to live happily ever after. And then they realize that their life is not going to be what they expected it to be. How do you handle that as a physician dealing with people in very trying times in their life?
Yes, so that's the difficult part of child neurology, and you obviously learn with experience over the years. And we try to give the families the full information, but we also tell them we are being very honest of what we know and what we don't know. Yeah. Because we all have seen children in our career where we thought they won't be able to do this few things, and they cross those barriers and challenges, and they end up flourishing and thriving and doing really well. And on the other hand, some where we think the MRI doesn't look so bad, they don't end up doing as well. Yeah. So I think we have to be very honest with the families, but we also have to give them hope and empower them. Yeah. So the hope part is a big part of the care package for any family when they are going home with a child who has been critically ill. Yeah. And I think the more we empower parents to get on that difficult journey, but provide them all the resources and supports and including the psychosocial and emotional support in the first couple years is very important. Yeah. But yes, this is something which comes with practice, and with it you gradually build that rapport with the patients, how to explain these kind of difficult conversations. Yeah.
My wife is a neurologist, an adult neurologist specializing in concussion and TBI. And one of the fun things that I see with her job is DTI imaging, this diffusion tensor imaging. Right. it looks like magic, and it looked like maybe that was one of the pictures potentially you had up where the agenesis of the corpus callosum was there.
Right.
How close are we to having that information, right? You just said one of the hardest things is, oh my gosh, this MRI looks great, your child's going to do well, and they don't. Or, oh my gosh, this imaging looks horrible, prepare for the worst, and the child does great. The brain is fascinating and super plastic, and we still need to know a lot. How close are we to understanding, like, why did this child do well and that one didn't? And using imaging like DTI imaging potentially to go, oh, I see where these connections happened. How do we force that in other places?
Right. So I think it's still in the early research phase. It's not available to do for every patient to be able to predict to that degree. Even like for agenesis of corpus callosum, where the connection is missing, we are looking at how the rest of the brain is formed, how the folds are formed, how the sulcal depth is. So all this is in early research phase. But the other research that has really shaped child neurology and fetal and neonatal neurology in the recent years is the genetic testing.
Yep.
The prenatal genetic testing, the neonatal genetic testing, whole exome sequencing, whole genome sequencing. So having to know, identify a marker that has caused the problem is always helpful in prognostication.
Yeah.
So I think putting everything together, the clinical course, the MRI and the genetic testing or other testing, that's always helpful but again, we always tell families that so-and-so is going to write their own story, and how they do over their time will be the best guide.
Yeah, I love it. Rebecca asks, how do you maintain a professional distance while forming such vulnerable relationships?
I think that's something that will come with experience, but we do get attached to the family, especially who we follow for several years, and especially from a challenging time. Sometimes it grows into a friendship, but yes, we as physicians, we have to maintain a little professional boundary. But I will say that over the years, we do really get connected. And child neurologists, if you ask any child neurologist, I think they almost feel like they're like the primary care for a patient with neurological disorder.
Yeah.
Because they look at the whole, what a patient needs and what their community or support that needs to be created. Yeah. So I think that connection piece with the family is very important also for building the trust.
Yeah. Just as a reminder for everyone watching, you can raise your hand on Zoom and we'll bring you on to ask a question. Tamana has an interesting question, and I think I know the answer. Day-to-day life of a fetal neonatal neurologist, is it mainly focusing around analyzing imaging, or are there more holistic aspects in physiology that allow for diagnosis or treatment? The old standard of medicine is you treat the patient, not the imaging. Right. So I'm assuming that's the answer.
That's absolutely the answer. We don't treat EEGs, we don't treat MRIs. We want to see what the baby is doing and how they grow over the years. Yeah. And we do take all the information together. What happened during the pregnancy, what happened at birth, what is the testing available. But again, how we see them grow over the first couple years of life is the best guide to what an outcome can be.
Yeah. Tori just has some appreciation. She says, as a CHOP CP mom, I just wanted to say that we notice and appreciate when you get attached.
Yeah. We love that too.
Yeah. So here's an interesting, potentially polarizing question. How has the overturning of Roe v. Wade affected your field?
Yes. So the field of so MFM is a side story, but fetal and neonatal neurology perspective especially, it is challenging because when we see brain malformation that may have a profoundly impaired neurological outcome, where we think a baby may have very limited chances of surviving or need to be dependent on lifelong support, we do have to bring in the counseling of how the other options that are there for the family and for the patient, for the mom especially. And it can be life-changing for a mom who is going through this and who doesn't have the option. So I think our maternal fetal medicine partners are the ones who are really facing the challenges and how they're helping and supporting the families through such decision-making and guiding them to the appropriate place for how to get the care that they need. So it's challenging.
Yeah.
Well,
yeah. Let me bring on Rosanna here. Hello there.
Hi, can you guys hear me? Dr. Agarwal, I was just wondering if you have run into a lot of instances where you share your own experiences with your family and dealing with a neurodivergent child, and if that's helpful for families to know that you can relate to what they're going through, kind of.
Yeah, I think sometimes I have brought it up, not on a routine basis, but where we see the conversation evolving. And I think by now, many of my colleagues, and when they read about me or if a patient reads about me on the website, they might know or they might see it in some of the papers I've written. But every once in a while where I feel the moment is right and the connection is there, I will bring it on and provide them some resources and experiences to be shared from which they can benefit from.
Yeah.
Thank you.
Nice.
Thank you.
Good question. So here's the question. Did you choose your specialty because of your child, or was that just serendipity that you had this field and expertise and having a child with CP?
So when my son was born in India, so I was doing MFM there. Okay. And when I moved here, the child neurology really was, I think, just as I've given the title of my essay that I've written for the students who are there and who may want to read it, the guiding star, it really just the way the things shaped out. But yes, when I was at Baylor and I was being mentored and they saw this career path, my mentors did guide me into the field of fetal and neonatal neurology. And I think the first time I was with my son at a developmental pediatrician visit, they did mention that I'll be a great fit for child neurology. At that time, I had not applied for the match. But when they saw and they heard that this is my experience, and she did say that, oh, you should look at child neurology. You'll be a great fit for that field. And you could give so much from your personal experience along with the medical experience. So I think serendipity and guiding star and a mix of being mentored into that path.
Yeah. And that's not to say, I think it happens a lot. There are a lot of questions where you're able to give a lot of experience when you want to patients based on your own life.
Right.
But that's not to say you can't be a great insert specialist here if you don't have experience with whatever that specialty is, right? That's like, you can be an amazing pediatrician and not have kids, just in general. So I know a lot of students have that fear of like, how can I be a great whatever if I don't have that specific experience? That's what training's for. You learn over time.
Right. And we all, if you don't have your next of kin, like a child or a spouse, but you all might have had a friend or somebody, a friend's cousin or somebody that you know who you saw being different neurodevelopmentally or having a neurological disorder. So these are so common that I think rarely there would be a person who would not have come in contact with someone they know who has faced challenges neurodevelopmentally. Yeah. And over the years, the experience and the people you connect with when you serve the patients, that helps you build your experience and your resilience for the field, basically, how you learn to help the families through such challenging times, and also that shapes you as a person and your perspective.
Mm-hmm. Pushbu asks, what are the future opportunities or collaborations that could be developed with respect to global health and fetal neurology?
So recently, so over the last couple years, I have built a fetal neurology consortium with collaboration across 8 programs in the US. And then this year, we launched our Child Neurologist Society Special Interest Group for Fetal Neurology. So we just had our first meeting in Cincinnati at the conference, annual conference. And our goal is to connect with centers globally and to be able to see if we can get a global group together. I am in contact with the group in India, which is like a Southeast Asian with all the neighboring countries. There's a fetal medicine group, but our goal is to be able to build probably a global network for fetal neurology. And there is already a newborn brain society, which is doing great work, but it's more like focused on the neonatal neurocritical care. But adding a fetal component separately would be a great idea also.
Yeah. Anandi asks, how is your training different here in the States versus India? Do you feel more or less prepared for residency in the US compared to your colleagues?
So I think I was more prepared just because of the years of experience as a physician. Mm-hmm. Ending up in the intensive care as an OB with the experience in high-risk OB. So I think I was more resilient and I was less nervous. And it comes to anyone with years of experience. And then the only thing I had to learn was like, I was really a surgeon by mindset, and I didn't even know how I will change into the physician mindset and hours of rounding and, discussing.
Boring.
So, and then Epic and electronic medical records. So all that was what I was, that was the path that I had to learn new. But my Baylor training, yes. And because I was an OB and I had dealt with such a diverse patient population, I was not hesitant to see adults, whereas pediatricians were sometimes more worried in the adult setting when we get rotated in adult neurology for 1 year. So those were some subtle differences. Yeah. And just being through so much, I think it just makes you more resilient, and you just take whatever comes your way and go with the flow. So that was easier.
Yeah. Here's an interesting question, not specific to your field, and you can choose not to answer it if you don't want to. Here in the States, if you want to practice here in the States, you were a practicing physician in India. We require people to do their residency training over and match into a specialty maybe different from their original one. Do you agree with that? Or should people hey, let's give you a test. Let's see if you meet our standards and let you go practice?
I think there could be a middle path. I know things are different and you will have to learn the system. And the medicine could be slightly different of what are the common diseases in India and if someone is changing their specialty. But probably there could be more credit for the number of years so my biggest challenge in matching into OBGYN was they were seeing the years from medical school. But I don't know if someone would look at the surgical experience that I had, right? So the applications, the way the match works is like years from medical school and how many years out of clinical practice. I've been doing research for a couple of years. So all that. But I think there could be some middle path where, someone who has a lot of training, give them a shorter pathway and see if they can work and serve in the underserved areas and build up the pipeline for the physician shortage. So I think we could benefit both the system and the people coming at it.
Yeah. And that's where we're getting more and more programs moving to competency-based kind of milestones versus just, okay, you've been here 4 years, you can leave. Someone coming from another country as a fully practicing physician may go, hey, I only need to be here for a year. Look, I'm fully competent. Great, go. Like, we don't need you anymore. Maybe one day we'll get there. Here's a good question from Jessica. Do we see more of these neurological disorders in geriatric pregnancies, or is it distributed uniformly throughout the age groups of pregnant people?
So advanced maternal age is high risk for genetic disorders, which can lead to brain malformations. Then in advanced maternal age, you could also see higher chances of diabetes and other medical complications that could further worsen the impact on the baby.
Yeah.
So yes, they could be more common.
Yeah. So it is a risk factor, definitely.
Right.
Okay. Is there anything our audience should know, everyone watching and everyone who will watch, anything else they should know about your specialty and potentially how to go look into it if it's something they're interested in?
So I would say it's a very exciting time to be a fetal neonatal neurologist and even to be a child neurologist. The field is evolving so rapidly with all the advanced neuroimaging and genetics and prenatal genetics. And I think it's a really exciting time. And the field itself is really diverse. Even in fetal neonatal neurology, you could be a researcher, you could be a combination of a researcher and a clinician, or just a clinician. You could focus more on neurocritical care aspects of it, or you could focus more on imaging aspects of it. So the field is so big and expanded, and it's really exciting. It's changing by the month and by the year. It's just evolving too rapidly for us to even assimilate all the information in time. Yeah. And I do get a lot of students from around the country, and we've had some international observers also. So we're always exploring. If someone wants to reach out and email me, message me, you want to chat more, guidance in the field, I'm always available. I love teaching, I love mentoring. So for any student who wants to connect, and you have my email on my PowerPoint, but it's available if you look up on the CHOP website. So happy to connect and guide you in your career path.
Well, Dr. Agarwal, thank you so much for joining us today on eShadowing. And thank you everyone for coming, 130 plus strong throughout the presentation. Everyone have a wonderful week, a wonderful day. I will not see anyone next week for eShadowing. I will be on vacation, but we'll see you soon. Dr. Agarwal, thank you so much for taking some time today.
Thank you so much. It was a pleasure to be here and answer everyone's questions and share my career path. Thank you for having me.
Yeah. Have a good day, everyone. Bye.